This is my audience. No waving.
Too late.
My name is Fran Yett, and I'm doing Communications 101. This is my speech for the persuasive argument in favor. Many people don't understand that the moment you conceive a child, you have already become a parent. There are decisions that you make all through pregnancy that will affect your child for the rest of their life. As far as foods that you eat, things that you drink, and medications that you take. And then there is the choice of where to have your baby. You decide if you're going to have your baby at home or if you are going to have your baby in a hospital. Today I will be giving the affirmative of argument to having your baby in a hospital. The fact that the vast majority of Americans choose to give birth in a hospital doesn't mean that they have chosen to have a medicated childbirth. It can also mean that they are going to have natural childbirth. Many hospitals today have birthing suites, and you can have the same kind of unmedicated childbirth in those that you would at home. The only difference is that if there is some kind of an emergency, you're already at a hospital where you can get the medical attention that you or your child needs. While you're in the birthing center or the birthing suites in a hospital, you can have a birthing coach, such as your husband, helping you with Lamaze techniques. And in the very next room, there can be someone who's had a very high-risk pregnancy, and they are hooked up to all kinds of monitors that they need, but you don't. If you do have an emergency, that help is only a call button push away. According to an article that appeared in the Daily Beast's website, there are two types of midwives, and midwives are normally used for home births. The first one is considered a certified nurse midwife. She is a nurse. She's had medical training. The other type is called either a lay midwife or a certified professional midwife. For the certified professional midwife, they're only required to have a high school diploma. They either go to midwifery school or serve an apprenticeship under another midwife, and they take a 350 question multiple choice test, not 4 to 6 years of medical training like a nurse would too. It's difficult to ascertain figures for complications for home births because most states don't require them to report them. One state, though, that does is Colorado, and their most recent figures are from 2009. This chart that I shows the 797 births that happened in Colorado at home in 2009, and of those 797, the red piece of the pie indicates the 20% or 160 parents, mothers, that had to be transported to a hospital due to complications. The 20% of them end up in the hospital already, and these are the lower risk pregnancies. Expectant mother that does choose to give birth in a medical facility is hooked up to intravenous fluids so that she doesn't become dehydrated during the process. She has heart monitors, and the baby has heart monitors and oxygen monitors so that they can decide if something happens that they need to intervene in the delivery. When a baby is born at home, There are no monitors like that, and the baby could have a low heart rate for a significant period of time, and by the time they figure out that the rate is too low, they can already have permanent brain damage. While doing my research for this project, I spoke to two nurses. One's named Kim. She is a nurse practitioner and has worked in the emergency room in Texas and here in Idaho. And she stated that she had experienced several poor outcome deliveries, as she termed them, from women who had attempted to deliver their babies at home with midwives. She noted several occasions where lay midwives didn't get the proper medical attention for their patients soon enough for the child to either survive or to not have permanent brain damage. My second interview was with Dana, who is a registered nurse that used to practice in Texas and now is in California. She has been a labor and delivery nurse since 2003 and has only done high-risk pregnancies for the last 9 years. I asked Dana about the risks that were involved with what they term as VBAC, which is vaginal birth after a cesarean. Said she has a lot of experience with those. And she stated that vaginal births after a previous cesarean carry what they consider a fairly low risk of uterine rupture and death, which is roughly about 8 for every 1,000 of those procedures. When a uterine rupture occurs, though, they only have 8 minutes to intervene, do an emergency C-section, get the baby out, and in order to save both the mother and the baby. If they don't get them in 8 minutes, they will bleed out, and they will both perish. That alone is enough of a risk that most practitioners will not perform VBAC. Usually once you have had a cesarean, that's it. You will always have a cesarean because they don't want to risk you rupturing during the procedure. Dana also noted that many complications during childbirth, before the advent of medical technology and intervention, that of regular childbirth then, that 1 in 3 had serious complications before then. So her opinion was that you should only attempt to do a home delivery if you have a certified nurse midwife or something higher, which would be a doctor, and that the location of your home should be within minutes of a hospital in case there is an emergency. So I believe that I have shown today that the majority of births are and should continue to take place in a hospital or an equivalent medical facility. Thank you for your attention.
Do I hand you the phone?
No. Show that my audience is still here.